Station called R4WH Health. It's an annual cross-country bike ride to generate advocacy for global health. So we're actually, a group of us are leaving in a week for San Diego, and we bike across the country, we give lectures.
How long does that take?
2 months.
Woo!
Yeah.
How do you get away with that? How do you get out of work for 2 months?
Most of us are fourth-year med students, so we're actually graduating.
Awesome.
Yeah.
Great.
Should be a good time. So I guess when I was in high school, had an opportunity to do some mission work with my church group, and we were in a small village in Mexico. I thought we did some really amazing work there. But during med school and college, actually no, that was college that we did that. During med school, I haven't really had a chance to do a whole lot of global health work. So when this opportunity came up, that'd be a fantastic way to end my medical school.
Not you, but it wasn't you.
So, getting ready to go.
Yeah.
You excited?
Very excited.
Yeah?
Very excited.
Why?
I'm excited to meet the team. We have a great team of people from, we have med students from Harvard, Yale, Loyola, Indiana, Oklahoma. And it's going to be great to kind of meet up with them in San Diego.
So why'd you get involved in the first place?
So, when I get involved, when I was a second year med student, I went to Global Health Day. I actually saw Deo Gracias come and speak. He's one of our speakers for this Global Health Day. He's the founder of Village HealthWorks. Village HealthWorks is one of our beneficiaries this year. Village HealthWorks has really revolutionized healthcare in Burundi, Africa. As a third-year medical student, Deo Gracias escaped the Hutu Tutsi genocide, and he went to New York, and there he didn't speak English, but he was one of the most brilliant medical students in Burundi, and he had to restart everything. He had to go to college, he went to medical school, and then he founded Village HealthWorks as a way to kind of return to his home country and provide better healthcare in a place where at the time was having a 10% maternal mortality rate. So he's been doing some great work. He worked with Paul Farmer, Partners in Health. I think that's where he got a lot of his ideas of how to make a sustainable and a really high quality global health kind of facility and partnership.
How about Empower and Advance?
So Empower and Advance, I'm very excited to work with them as well. Dr. Aisha Khan was an emergency medical physician here, medical student. And she was a mentor to me, gave me advice on medical school, on choosing what type of medicine I might be interested in, and she was a great person to shadow in the emergency room, the way that she talked to patients and really connected with them. She ended up going to Stanford to pursue a fellowship in international medicine, international emergency medicine. And so she's been starting with getting community health workers trained in Haiti by training secondary school educated community members. So it's a sustainable program there where they can respond to emergency conditions.
So aside from the raising money part, what are you most excited about for the ride?
I think just the opportunity to spend 2 months with some really amazing people who are very passionate about global health, about making a change.
That's very cool. So what are you looking forward to most with the ride, besides meeting people?
Besides meeting people?
For you personally, are there any goals you want to meet?
For me personally, I really just would love to see my quadriceps get stronger and stronger every day.
You got a lot to go.
Yeah, so that's
calves
good.
look like
And
Jing's
my calves by the end of the ride, so that I can also put some advertising space on it. So I got some work to do.
Cool. What are you dreading most about it?
The hills.
Let's talk about, how great of a job you're doing at reaching out to these places and do better. Notre Dame.
Yeah.
I really think that the Notre Dame, how funny was that Roxanne out here? She was,